My name is Erin Campbell. I am a registered nurse at a long-term care facility, and I am a student at Purdue University Northwest in the RN-to-BSN program. I just watched the video Chasing Zero with Dennis Quaid in it, and my first thought after watching this video is that safety should always be the first priority in any healthcare setting. We should always be putting our patients' safety first and trying to prevent any harm. And when we see anything that could potentially cause harm, we should be speaking up. My takeaways and lasting impressions are that when nurses notice mistakes, a lot of times they are reprimanded. And that's something I've seen in personal experience, and like something that was brought up on this video as well, is that a lot of times nurses and staff are afraid to come forward because of the fear of being reprimanded due to these issues. So I've seen many near misses, starting with I've seen actual misses. So when I was a brand new nurse, I had a situation with a patient who was on a lot of pain medication. They took 3 different narcotic prescriptions of pain medications, and for the size of the patient, the amount of medication they were getting just did not make sense. Because you would go assess the patient and they would always say they weren't having any pain, but they were always due for pain pills, for routine pain pills. And they would even ask for some PRNs in between. Well, we had a situation where we had noticed that he was nodding out and couldn't keep his eyes open to talk. And it turned out that the orders that were written from the prescriber were not entered into the computer correctly, and he was actually only supposed to be on 1 of those pain medications instead of 3. So that is a situation where I think that real harm was caused to the patient. For the record, he was transferred to the hospital and evaluated, and he pulled through and he was okay. But that is an example of like harm can be caused anywhere. I've seen a lot of near misses with situations like in long-term care. You'll take vital signs, and because they are usually elderly, sometimes their vital signs will be a little off, a little different. Their blood pressures might be a little bit lower. One time I noted that a patient had a charted blood pressure that was 80/40 from the shift before me, and I had just gotten on the clock. And that blood pressure was taken about an hour before. And so I asked the previous nurse, I said, okay, so, did you notify the doctor? Did you notify anybody? And she said, no, I didn't. It was 5 a.m. and I thought she was okay. I didn't notice that her blood pressure was that low. So I notified the physician and got orders and started to take care of the issue. Went to go be with my patient at bedside, and stayed with them until their blood pressure was up. So there are just many things that can occur in these long-term care settings and in any healthcare setting. One of the things that really stuck with me through this is that the family of Cal and Pat, how the wife and mother, she was impacted twice by failed safety of the hospital. And it breaks my heart because they deserved better. The pathology report should have been read correctly and not just filed without anybody making sure that it had been communicated. And for her son as well, with the jaundice, that should have been addressed. And I know that when I had my child, she had jaundice issues, and they would not let us leave until everything was okay when she was first born. Okay, what influence does sharing of errors have on your nursing practice? So I would say that usually when you share errors, you are kind of treated like the criminal in nursing facilities, or you're treated kind of like the bad guy for being a whistleblower. That's what I've seen. However, I think that the culture of that needs to change. I think that it needs to be that we need to be seen that we are actually trying to prevent patient harm. We're trying to help our patients rather than let, things happen that were preventable.